So thank you everyone for joining. I'm really excited for this. I'm really excited to hear from Rizwan. Just to introduce myself, I'm Tristan. I'm the co-founder of Orbion alongside Yosha. We put together this webinar because we're looking to sort of start a series of events where people can join and learn from people who've already moved into the industry and learn how that they might be able to follow in the same steps. Which is why we were super excited when we found Rizwan, and we could hear from his story and perhaps give some advice to you guys and how you can do the same. These events are going to start as sort of online webinars, but we're looking to host some in-person events as well. So keep an eye out for those. Just to introduce Orbion. So we're currently in building our MVP, but we're going to be a platform that essentially instantaneously connects MedTech companies with healthcare professionals, ranging from doctors all the way to nurses and pharmacists and medical students. We're looking to increase access to health tech and medtech, and our platform is looking to do that. If you want, you can join our waitlist or our email community, where we essentially send out health tech opportunities which aren't posted anywhere else, and you can learn a bit more and get some experience in the industry.
Yeah, I'll put a link to that in the chat, and we'll just make sure this is recording as well, so that people who look back on it can access it too.
Yeah, for sure. Cool. And Yosha's just going to introduce the King's Academic and Research Society.
Yeah, so this is kindly organized with another student, a medical student called Malik. He unfortunately couldn't be with us today, but he does want to pass on the fact that King's does have their very own clinical and academic research society that you can get involved with, and they host some really exciting flagship events such as this conference here, which is the London Medical Schools Research Conference, and I think they host it around springtime. And if you do want to get involved as well, they have their own links, their own social media to check out, where they will be signposting you to these events. So please make sure to check out KCL Cars as well.
Thank you. So I'm going to hand over to Dr. Rizwan now, and he's going to talk us through his own experiences. So he's got a lot of experience with medical imaging and AI, and he's worked as an NHS consultant radiologist for over 17 years. And he's very involved in this industry, and as I'm sure he'll tell you all about. So I'm going to hand over to him now. Thank you very much.
So good evening, everybody. Thank you, Tristan and Yosha, for the invitation and actually for putting this platform together, which I completely agree with you. Given the world that we live in now, the healthcare environment that we operate in is very different to when I started. Okay, not quite from when the dinosaurs roamed the earth, but I think there was a time and a place, and that is actually the career that I envisioned to myself, which is you worked your way through the training scheme, you were given a consultant job, and that was, the start of life. You had registrars who'd polish your Bentleys and life would be great. Sadly, no Bentleys, no registrars to polish them. But actually, even more so than that, the concept of you being wedded to one institution and one department and one career isn't particularly applicable. And why am I saying this to you? I'm saying this to you because I didn't go into where I am now in any sort of Machiavellian pre-planning. And so anybody who's on this call who's worried about when do I start, it's the age-old question, isn't it? When's the best time to plant a tree? 20 years ago. When's the second best time? Now. So you've already ahead of the game because you have an intention and you are meaningfully engaging in how to position yourself to a particular career structure. So kudos to you all. What I've actually been trying to do for the past 2 or 3 years in particular is to support these kind of ventures, which is why I was more than happy to join this platform and this call in the first place. I've been running webinars like this for the past 2 or 3 years. I run careers events annually. There's another one which will come up in early 2026 with a view to people who are interested in pursuing portfolio careers to dabble alongside the clinical, or indeed to transition entirely into the commercial space. So how did it start for me? Honestly, it comes to one particular person and one particular platform, and that for me was LinkedIn. Okay, as I said, I got my consultant job at the Royal Bolton Hospital. I am still a consultant radiologist who practiced there. I figured on day one, I would go into my office, I would turn on my workstation, I would report for my life, and then when I was going to retire, I'd turn it off, and that were that. What I then found is that there was a platform, and in those days, let me take another step back. This concept of engaging with software companies really wasn't a thing. Okay, the nearest we got is what some of you may have had. You had all these lunchtime meetings. A sales rep or a drug rep might come in with a bunch of sandwiches. You'd sit there, you'd munch on them. Back in the day, and I don't think you do that anymore, we'd every so often, particularly as a trainee, we'd get treated to drug rep meals of an evening as well. And that was about the nearest we got to this sort of engagement. That's all clamped down now because everyone is ridiculously paranoid about sullying yourself. But that principle within the NHS is something which has pulled through, and it's very, very different, for example, to the way clinicians in the US and in mainland Europe are treated. We seem to have this rather strange view that we need to lock away our clinicians because you can't trust them, because taking a bite of that £1.99 M&S sandwich might all of a sudden mean that you're susceptible to bribery and corruption, and it's not the done thing. And the mindset, of course, is that we as clinicians never engaged with, apart from the select few who had a career mind to go down the sort of medical director or the medical management role. Procurement was something which was done unto us. The software was something that was done unto us. We were given it, learn it, crack on and use it. And even in radiology, you know, I practiced in a career where I used the output from very, very expensive equipment. We used software which cost hundreds of thousands. When stuff went wrong, and for me as a geek, you know, I used to build my own computers. I enjoyed dabbling. I never got to speak to the people who provide the software. I had to talk to our PACS manager, tell them what I thought was wrong. They would then translate what I thought to a company who would inevitably say, he's the first person in the entire universe who's ever had that problem. It must be him. It can't be our software. And I would get that reply back 25 million times when I kept flagging the same problem. And it was frustrating. And my view was, well, if they don't really care about me as an end user, what's the point of engaging further? That changed actually when you go to conferences. You have these exhibition halls, you wander through them, and I used to keep myself aloof from commercial entities, which was, what's the point? It's not as if anything that you're displaying is something that I could use, and it's not as if you really care about what I think. There was one particular summer, I had a banging headache. The coffee at this stall smelled fantastic. I sat myself down. I figured if I sat at this stall, I probably should listen to what this person is saying to me. And we got chatting about my views of PACS. This is the software that radiologists use, and how it wasn't really conforming to the way I work. And he went, well, how much of that you fed back? And I explained my rationale, which what was the point? And then I learned at that stage that the R&D in the commercial space is very different to my very, very sheltered view that I held apart. The other thing I discovered in those times was LinkedIn. And I basically put my heart in my sleeve, and I used to share the world according to Rizwan on LinkedIn. What I thought about enterprise imaging, what I thought were the issues with the radiology space, why weren't the things that I thought were a problem being addressed. And what happened a few years after that, first is I found a CIO at Bolton, Chief Information Officer, who was aware of this radiologist in her hospital, who clearly liked talking about this stuff. I sat down and had a coffee with her. She asked me if I wanted to get more involved. I said, great, and that was that. The next part of it was I got a call from the director of a company called HSS Chris. Now, at that stage, they had 72% market share of the software we use. The name of the company is irrelevant, but it's more to the point that This chap managed to get through my secretary, and that was honestly a feat in itself. She's fiercely protective of me. And to this day, I remember this conversation. Hi, Dr. Malik, you're giving us a really, really hard time on LinkedIn. And it caught me a little bit on the back foot. I was about to start apologizing, but he was, no, don't apologize. We agree with everything you're saying. Can you help us fix it? This was a revelation to me. Here is me using software, struggling with how to get anyone to listen, and all of a sudden one of the directors of the company are listening to my views, which were broadly talking about the space. And none of this was ad hominem to their software, but they clearly recognized what I was saying. And so I met with them. I spoke to my trust and I said, look, here's the scenario. I've been approached in this way. They were asking me if I would be able to offer the medical advisory input. Do you think it's a problem? The CEO laughed, the medical director laughed and went, well, given that pretty much everyone in the country uses it, there is no conflict, isn't it? Because it's not as if you're selecting anything in particular. And if you do it, we as your trust, will get a bit of reflected glory, so go for it. It was all above board. It was all very transparent. The conflicts were dealt with. And what I found was a very, very different world to what I experienced. And I shared some of that feedback to them. I shared one scenario, for example, where I managed to cut through this, going through my Paxi manager with a problem and getting knocked back, to them suddenly sending someone to my trust to listen to what I said and try and deal with it. And that was a very standard experience. This person came in, clearly wasn't there to listen to me. I heard you've flagged this problem. It just can't happen. So, all right, fair enough. If that's how you want to play it, that's how you want to play it. I said, so here's what we're going to do. You're going to sit down. I'm going to show you the problem. And if I can replicate it, clearly you aren't the world authority you think you are, and you can get up and leave. He sat down. I showed him the problem. I clearly wasn't the only person in the world who did it. Attitude changed. And I said, well, no. The deal was, given your attitude, you aren't the right person for this, so get up and leave. He took it by surprise. He actually didn't know that I was working at the time where I just started to work with the company. And the reason I'm mentioning this is this was a sort of environment in which we started out. There was this adversarial approach. The clinicians were still, like any IT person, users, who needs them, right? They're the source of all the problems. Unfortunately, we don't really help ourselves because sometimes we are. But I fed back that this is the problem you as a company face, because as an end user, this is what I experience. And you're doing all this great work internally. We can absolutely work together at the software side. But if you're not going to change your customer facing approach, you've got a problem. That basically was my view of life that I was taking forward. Shortly after this, we actually have a formative procurement for the software, the main imaging software we use. Myself and Professor Rachel Dunscombe, who's the CIO of Bolton, went around the region. We said, look, we're coming towards an end of contract. What do you reckon? Should we have a look at what's out there? Let's be clear. I was a nobody from Nowheresville. I'm still a nobody from Nowheresville. I'm a radiologist from a district general hospital. We have some of the great and good in Greater Manchester and in the country who work nationally in our region. Okay, so me going, should we do something? It was a little bit odd. They sort of said, there, little boy, we'll let you know when we want to do something. This is all tongue in cheek. Nothing's meant. You're not meant to take offence to this. Well, you are a little bit. But then we had the conversation back in Bolton. We are still end of contract for this piece of software. Do we still want to explore what the world looks like? And I said, why not? So I wrote basically a wish list of what I and we wanted from Bolton, almost a demo, and I sent it to all the PACS companies in the region. And the view was, I will guarantee you the same room, same audience, same day of the week, pitch to me. And so at the end of 12 weeks, I basically had a 20-page pros and cons of documents with our in-source feedback. We had radiologists, we had radiographers, we had IT involved. And then I also sent it to the region. So then said, well, you've done all this hard work. Yeah, there's clearly a case to be answered. We'll take it from here. The take it from here was the commercial companies then said, that's great, Greater Manchester. Where's this guy we've spent the past 6 months talking to? He should be part of this. And the next thing I know, I'm involved in the procurement. At the time, it was the largest imaging procurement in Europe in terms of data volume. And very soon, alongside my good colleague Ridian, I was the clinical lead for the procurement. And that gave me experience not only of engaging with commercial companies, but actually to understand the nuances of how to engage respectfully and irrespectfully with commercial entities. And I say irrespectively because we need to be clear. It isn't about here is a shiny ball, do something with it. You are the people who use this thing, and it is for you to use your voice to feed back. And when I used to make the challenge saying, I have all these issues, why are you not addressing them? The one thing which resonated loud and clear was, Rizwan, who on earth are we meant to hear these from? None of you clinicians speak to us. So during the course of this 5-year tenure, and it took 5 years of my life, I had a black beard and black hair when I started, and that really aged me. What I learned loud and clear was this voice that we want people to be able to speak to. So my pushback to industry was, you're telling us you don't have that person. Well, do you know what? I'll do it. I'll be the guy you can liaise with to have these sorts of conversations. It ended. Again, I spoke to my CEO and I spoke to my medical director saying, hey, listen, I've got an idea. I think I might want to make a career of doing this advisory stuff. They laughed and said, aren't you doing it already? You spoke to us a few years ago. And yeah, that's fine. That was during my day job when I was still doing this as part of a full-time job. I actually wanted to do this seriously. And I don't mind if you think that's at odds with being a consultant at Bolton. I still, I've spent a lot of my time. I'm a working class lad. My parents went through a lot of struggles to get me where I am. I still believe in the NHS and I still want to be a radiologist. Can I go part-time? If not, I'll resign and I'll just pick up NHS work ad hoc as a good. And again, they laughed and they went, well, it's about time you realized it. We saw this coming a mile away from you. Why would we want to replace you when we'd still have to go out to tender? So, part of Rizwan is still better than no Rizwan. Let's figure this out together. And kudos to my trust. They have been really helpful, and they've been really helpful because from day one, I've always maintained dialogue with them about what I wanted to do, what I wanted to do. Everything was always clear and transparent. And I'm going to say the next thing, tongue in cheek, but we'll come to why later. I was whiter than white because part of the issues is perceived conflicts are more toxic than real conflicts, and you sort of need to deal with some of these aspects going forward. So what did I bring into this game when I went out? Well, part of it was people knew me because I'd been engaging with the industry already. I then suddenly realized over that conversation over coffee a few years ago, there is a value to going to conferences and treading that exhibition hall and having these conversations, bring that network, putting your name out there so they know who you are. They can put a face to a name. I wrote about my views, but they weren't with a view to an end game. Okay, I used to write for the love of the sector. It was, here is how I think imaging should be great. Here is how I think AI should be great. What had then happened? AI became a thing. The great and good of the AI world, our Nobel Prize winning Professor Hinton, we've got VCs like Vinod Khosla were telling me that I'm going to be out of a job. I am Wile E. Coyote over the edge of a cliff, blah, blah, blah. All this. And so again, it was a reflected piece for me. If at this stage of my career, it's 2017, I've been a consultant for a decade, if I really am going to be out of a job, let's look into it. How much is real? How much is smoke and mirrors? And from then I pivoted to, well, there's a lot of guff and gubbins going on here. What would AI according to Rizwan look like? And then I started to write about my views. And I'm going to direct you. I've pinned a couple of links to my website, and one of them is insights, and pinned at the top of that is something I wrote in 2019. And I say this not with hubris, but I'm going to challenge you to read that and tell me how many of the things that I suggested of the art of the possible have we still done now? How many things that I talked about then are people now in 2025 and going into 2026 talking about the next great thing. People talk a great game, and it's easy to talk a great game. The reality is very different. Okay, what I was selling as my USP in the commercial world was I'm a practicing clinician. I understand tech, but more importantly, I understand workflows, and I'm working with you to embed your workflow to what makes it work for me. The same way your marketing, your PR, this is what you think you're saying. Let me work with you to make it relevant to me. Me just being a random clinician, and if it's relevant to me, it'll be relevant to your target audience. And that is something which there are loads of people who do this now. At the time, there were 5 clinicians. We could name them. We all knew each other. We all had our own particular niches.
What?
Sorry? And we went out into the wild of providing these services. What I was mindful was that for me, this was partly a transition to what I wanted to do. I then had compartmental parts of my life. I had my NHS role, which is carry on doing the doing of being a radiologist. I've also, been a clinical director. I've been the medical director for diagnostics in my hospital, so I had that experience of mentorship, of leadership, blah blah blah, and I enjoy it. I enjoy the strategy, and I found an avenue where I had people not only who were willing to listen to what I wanted to say, frankly, they were willing to pay for it, and that's a novelty in itself. I compare that with the day job where you run through so many brick walls, so much red tape. I couldn't give away these ideas for free in the NHS sometimes. You compare that with being flown business class to the Middle East and the US to give talks. It's great. Okay. But what it comes down to is there has to be something that you're actually being recognized for. No one's going to want to pay you unless you have opinions that are worth paying for. So you have to start somewhere. And I think there's a little bit of this incentive or this mindset that, well, all these people are doing all this stuff. It must be fairly straightforward. Well, it can be fairly straightforward. I want to get in on it. No one seems to be willing to give the hard yards of getting the background. And the background is your USP as clinicians is your clinical day job. Okay, there are lots of questions that have been asked in the chat of, well, what can I do alongside this? Should I learn coding? Should I do this? And actually what I found when I started to give talks and when I started to have this conversation of how did you do the AI stuff, Rizwan, I used to start by making excuses. I'm not a data scientist. I'm not a coder. I'm not this. I'm not that. And then I paused. You're right. I'm not any of these things. I've never claimed to be. But what I am is I'm someone who understands technology, someone who understands workflows, and someone who understands the importance of embedding technology into what we did. And if I take that with COVID, which was when I deployed one of the first deployments of artificial intelligence in the NHS into radiology. It's there in pretty much every hospital now. How did I do it? Again, there was a reputation of this radiologist in the Northwest who is into AI. There is a particular week I can reference where 55 companies called me, emailed me, pinged me. Hey, Dr. Malik, we've got an AI. It can diagnose COVID. I went, well, it's been around for 2 minutes. I'm a chest radiologist. I'm still trying to figure out how it can do it. You looking at 5 chest x-rays probably isn't what I need. But what I did think was that there potentially would be a way that, where this is a devastating global scenario. There's got to be something we can do. And the eureka moment for me was the 6 p.m. news one day, and it was a report from Italy, which were talking about how their ICUs were becoming swamped. Patients were dying, doctors were dying, and the thought that was going through my head was what if we could get ahead of the curve of trying to identify who is becoming unwell enough to need to go to high dependency ICU, and those who are there, how could we identify ahead of the curve who is getting better? What I'm talking about, progression monitoring. So rather than being done unto, I then put the challenge out. And so this is the thing, okay? There are various Rizwan challenges. I've put them out for radiology, I've put them out for diagnostic screens, and there was a quote unquote Rizwan challenge for AI in radiology for COVID. are any of you, can you prove that you've got an AI software which can help me manage progression monitoring? And if you have, show me what it was trained on. Show me, given that we're going to deploy this within the NHS, some likeness in terms of your data cohort. I whittled down from lots of companies talking the talk to two. And one of them was actually a company that said, funnily enough, we're doing this as a trial in Italy, exactly what you described. Do you want to work with us? And clearly there's no financial issues here. No one's going to be talking money for you. And that's how I ended up working with Cure. We deployed them. But the crucial thing is, it wasn't, here is what we want to do. I wrote the use case and we worked to what I wanted to do. I spoke to my medical director, I spoke to my colleagues, and we tried to pivot going forward. And that really is what I really want to impress to you in terms of how do you change your mindset. You need to have a USP of what you're selling, for want of a better word, but you need to have some experience, I would suggest, going forward. There's been lots of talk about what I'm saying now. There's lots of controversy. There isn't controversy. There are a million ways to do what you, ladies and gents, want to do. This is simply my view of life and how I would suggest you can pivot what you want to do. Personally, I think there are people who are going to be far better coders than I can ever be. Why do I want to bother? I have a basic grasp of use of tech. Okay, as I said, I used to build PCs for fun. There is no point me learning tech. I've got radiologist friends who are actually really good coders. They have a different view and they offer a different skill set. Again, data scientists understand this aspect of things far better than I do. Rather than me trying to do pigeon, I should understand the basics of governance. I should work with colleagues who learn better than I can. But what do? I'm offering 20 odd years worth of clinical experience. I'm offering the relevance of your tool for what it can do for me rather than what you think it can do for me. And what we've had discussions often is either you think this is great, actually I don't think it's going to add value. And I'll give you a really simple example of this. I'm a chest radiologist. What does that mean to my career? Well, I spent a lot of my time now, I am basically a chest nodule counter. All this, looking at HLCTs and the esoteric stuff, great. Everyone now finds all these little distals because our scanners are great, and I count 2 to 6 millimeter nodules, and half of my life is taken up with this. So you'd think an AI which can do that for me would be great, and you're right, I thought so too. Except, of course, what does it do? A lot of these AI companies draw pretty coloured circles around these nodules. I still have to verify whether I think it's an actual nodule. I still have to verify whether I agree with the measurement. I still got to put those measurements in the report. So not only am I still doing the same stuff, the screen is more busy and it's adding work to my workflow. It's making me less efficient. But the principle for that would be get that CT, you measure all those nodules, you decide whether they were there before or not, you decide AI whether it was bigger or smaller. Then you put all those findings in a nice tabulated aspect. You correlate with RESIST criteria, British Thoracic Society guidelines, Fleischner guidelines, and you give outputs in a nice summary. So then I don't have to bother with nodules and I can use my grey matter to deal with all the complex nuances of what's going forward. And all these time later, we aren't there yet. But that is the kind of input you have, which takes the principle of what someone wants to do and puts it into the real world of what's relevant. So what can you do now? Well, get your clinical training. Wherever you are, not quite make yourself a nuisance, but engage with what's going on. Okay, in your workplace, in your training scheme, you are going to have deployments galore. You are going to have research and environments that are going on day in, day out. Understand those, and by doing that, you are also demonstrating your interest. Okay, there's nothing really worse than having a reach out for someone who's in your organization and in your region to say, hey, can you give me half an hour? Can you give me an hour? I want to do what you do. And you think, well, there's a load of projects that have gone on for the past year and a half. I haven't ever seen you reach out for any of those stuff. Whereas those people who do, you automatically self-select as somebody who is wanting to take the time and space to learn. In terms of courses, do you know what? There are 50 billion conferences. You can probably find one a day if you really wanted to. There are a whole host of massive online open courses. Half of the so-called people with LinkedIn profiles of AI experts have probably done a 2-week or 2-month Harvard AI course. Do those, they give you grounding. But ultimately, nothing is going to give you a better grounding than touch, feeling, smell the products, and touch, feeling, smell, engaging with people, networking, going out there and just trying to understand how the world operates and putting it in your own frame. Half of you on this call have probably got podcasts. The next bit of it is differentiate yourselves. Honestly, when you've got 27 medical students and FY1s and 2s, all of whom are trying to show their integrity in the digital space, all of whom have got podcasts, all of whom have got fancy mics and kits, how are you different from anybody else? Find what's important to you and use that, because again, whilst this is interesting, ultimately this is what you're going to spend time doing. And if you don't enjoy it, do you know what? It's not going to be something you're going to throw your heart and soul into. Those are the basics of what I wanted to say, really, which is what I effectively did. I said tongue-in-cheek to the organizer before, if I were to give a subtitle to this talk, my talk would have been Lemony Snicket's a series of fortunate events. Because what I did was I simply encountered moments in my life and I pivoted and I found things that I thought interesting and I just lent into it. And in doing so, time after time after time, I found I enjoyed them. I found there was a niche which other people weren't doing. Frankly, I found I was quite good at some of it and I carved a career out of it. All of you are going to have nuances and you're going to find little brackets of things that you enjoy and little pockets that you want to get engaged with, and you can. There is no right time and space. You can do it, and honestly, there isn't really any magic bullet or any particular Hogwarts that you need to go into and come out in the other end. We don't want Me Too clones. Clinical commercial companies need you. Okay, we need as much clinical engagement going forward. We need as much engagement to have tech which is relevant to the world in which we live in, to provide what there aren't enough humans to provide the healthcare that we need. We need the technology to allow us to put the humanity back into healthcare. Do it, engage with it, and find the bits that you can add that nobody else can. I think I'll pause there, and we can maybe take some questions. I can always go back and expand on that as needs be, if that's okay.
Yeah, thank you so much, Dr. Rizwan. That's been really useful, and I like that it's a little bit different to the spiel that we often hear. I know, like, we've been to quite a few conferences, and I think everybody has their own valuable insights to bring into health tech. So it was really nice to hear from your experience. And I do have a few questions. I want to encourage, if anybody does have questions, pop it in the chat, as Yogesh has already done. So maybe we could start with that one. What's the best way to start as a busy GP? Or that could even be a busy medical student, probably.
It can be anything. Honestly, that's only you can know how busy you are. And the problem you have is we can get too bogged down being busy. Okay. I started this when I did 13 PAs, and given that, Monday to Friday, 9 to 5 is a 10-session week. So I was basically doing sort of 7 days a week during my clinical work. But you make time. There's the old adage, is if you want to ask someone to do something, add a busy person, because they will find the time and space to do something you enjoy. You as a GP are going to be inundated with requests from AI companies, health tech companies, MedTech companies. Find one which is of interest to you and just, sit down. Find time and space to do a pilot. Find the gaps that they've got that you might think you want to work with, and just lean into it going forward. You applied to Heidi and got no reply. I can't respond for Heidi. I can't respond to all of them. As I said, respectfully, I get multiple messages, emails, LinkedIn inboxes a day. Commercial companies probably get hundreds of them. Differentiate yourself, network, and that's probably the one biggest thing. You're going to have to get out there. You're going to have to press the flesh. You're going to have to sit down and do all the things which you're not necessarily comfortable with. I went into radiology because I like sitting in a dark room, and that's the nearest I want to get to patients sometimes. And yet there I was going out networking. I don't drink, sitting down with mocktails, doing all that kind of stuff. And the more you do it, the more you're visible, the more people are hearing what you've got to say, the more that they will pivot back to picking up a conversation with you.
Are there any sort of recommended areas or places, conferences that you recommend to network? I think that's what some of our audience would like to know.
I'm afraid there's no simple answer for that. As I said, I could probably retire as a radiologist, and if someone paid me for it, I could make a career out of going to a conference probably every single day. There are loads. Each of them has a slightly different scene, but also be mindful. Be selective with your time as well. Respect your own time. Look at what the theme is of a conference. Look at who's presenting. Look who's sponsoring. Look who's going to be there, and look at what might be of interest to you before you give up your own valuable time and space. You're taking annual leave, study leave, budgets to do it. There can be a bit of a circuit where the same people go round and round, with the same slide deck. Been there, done it. I've got master slide decks which I can talk through. But ultimately, at any one time, you might think, right now, I want to go to a space which is dealing with medtech in general practice. Well, then there are a whole host of general practice specific conferences to go to. You frankly can't avoid AI in any of them anyway, so that's not something to worry about. You might think, well, you know what, I want to focus more, not necessarily on the clinical bits, but just on tech. Well, then there are things like HIMSS, which UK, Europe, global. There are medtech specific conferences which CIOs go to, which you as a clinician might not necessarily in the past would have put yourself to. But given that you want to pivot into this space, go to the conferences which are more about the digital and tech side of health tech. And again, it'll give you a different format. You will then be the celebrity clinician within this environment, which is mainly tech folk. It's all about trying to find the environments which you're not really used to being involved and being seen. There really is a out of sight, out of mind aspect to some of this, unfortunately.
Yeah, thank you for that. I have popped also just from a quick sort of chat GPT prompt, I've put in some of the health tech conferences taking place in the UK that you guys could get a start with. I also wanted to ask, so actually there are a few more questions in the chat. So I think just asked, what are the key ethical challenges medical students should be wary of when it comes to AI in healthcare? I think that's very pressing.
I think that is an excellent question. And I think the first part of that is being aware that there are ethical challenges. It sounds silly, but it's a good place to start. We are all too often swayed by the shiny, okay? Don't be shy about asking impertinent questions. Where was this trained on? Where does that data go? Which regulatory compliance do you have? Hang on, is the regulatory compliance in line with your use case? And these are some of the basic frame. And some of this thing is put yourself in environments where you're listening to people ask these questions, and in your own brain, you build up a framework of next time I sit in front of an AI company, before you get my time, I need you to answer these basic questions. And it almost goes back to my workflow question. It's I'm not going to be done unto. Here is the problem statement I want resolving. Can you do it? Have you got regulatory clearance to be able to solve that problem for me? Show me. Okay, and you'll find that even to this day, there are lots of people who talk a lot and don't say very much, because you know what? They have the mark your own homework levels of regulatory compliance, which doesn't really comply with it. Where does your data go in ChatGPT? There's all these throwaway comments, which is if you're asking, don't be prepared. If you're prepared to have what you said to ChatGPT on a bulletin board, a big notice board in public, that's fine. If you don't want that in the public domain, that it probably isn't the right environment for you to be asking that question for. Understanding where things go is a real important part of knowing what you should be doing and what you shouldn't be doing with pieces of tech.
Fabulous. Thank you very much. There are a few more questions. If we could just put the questions in the chat, then I can find them pretty easily. Ali said, did you ever face challenges working with companies because you're a doctor rather than coming and you have a clinical background versus having a commercial business background? So did you ever feel that in your work you felt outside of the skill set you had built as a doctor? And if so, how did you fill in that gap?
That's an excellent question. Yes. And I go back to, if you remember, I talked about that, starting every conversation with what I'm not. Okay. I think part of it, it's a very fine line. I think sometimes we find in the very rarefied environment we operate in as medics, that it's all too easy to lean into, well, I'm a doctor, I've been through medical school, I've learned all this stuff. The rest of it's easy. It's not. And I think respecting that people in different environments have skill sets that you don't have, and just having the humility to understand that there will be a lot that you don't know and that you're open to learning is going to be a good place to start from. Okay. The rest of it is sometimes it's a little bit odd. When I started, the big elephant in the room, and this is something you're going to encounter again and again, is I was given a salary. Okay, I never had to sort of hustle or work out what I'm going to charge. I had to literally sit down and work through the charging spaces, and then some of the first early engagements, all of a sudden it was, really, you're charging that? But you're a consultant, are you not embarrassed? And all of a sudden, I was second guessing myself. Oh, am I charging too much? And everybody wants, just realize in the commercial world, everybody wants everything. They want it for free, and they want it yesterday. You're no different, okay? When you're wanting something of somebody else, you're wanting it for free on your terms, but you need to understand that the same is when you're negotiating with a commercial company, and this is something I think the NHS gets very, very wrong. For you to have good software, that company needs to do R&D. To do R&D, it needs to have money to do it. To get money to do it, it needs to make a profit. This concept of how dare you charge this and how dare you make money, this sort of communist mindset, if I say, is something we need to break out of. And understanding that aspect to it, understanding that you're working with companies who need to make a profit for you to be, frankly, to be able to pay your consultancy fees if nothing else. These are the kind of things you're going to take blinkers off. You're going to go into a world which is very different to this very, very narrow environment that you're used to. And some of it you'll find works for you, some of it doesn't. And in that regard, actually, what I would suggest to you is be very attuned to your own principles. And there are times when if you're having a conversation and it doesn't quite smell right, or it doesn't sit well with you as an individual, don't be afraid to walk away. Okay? There is this thought that, well, I'm starting out, I need to do this, or I need to do this. No, because at some point, if you're already starting with the concept of compromising your values and doing it, where is that going to lead? There's one great anecdote, and forgive me if I'm just giving anecdotes, but I'm just trying to share scars so you don't. There was one scenario where actually was, I started out, company approached me, wanted to work with me, and we never got anywhere actually with what I wanted for my time and what they wanted to charge me. What was interesting was I've always said all along, I build my network not because I'm looking for places where I want to work. I build it because I enjoy this world. I enjoy meeting people who do cool things. And sometimes in itself, that's another scenario. You need to understand boundaries very clearly. Some of the companies I worked for would get annoyed or irritated when I was talking about their competitors, how great it was. And I was very clear. I work with you to do this. I'm working with you because I think what you're doing here is cool. That doesn't mean I'm not allowed to talk about others, and that's partly the USP of me being an independent advisor. But in this concept, it was, do you know what? Just because we haven't agreed to work together doesn't we can't still stay in contact. And the reason I mentioned this was 6 months later, I had another conversation with that same individual, and what they said was, Rizwan, I'm really, really glad that you turned down my offer, because that was a life lesson for me. And what that taught me was, had we done it, we probably would have fallen out very quickly. It was basically, I felt that there was someone who wanted a clipboard and stopwatch, and my view was, I'm a professional and I want to just, you know, give you what I want to give you, and I don't clock watch, so why should you? And let's find the middle ground. And the value is we're still friends, and we're friends despite not working together and actually having that rocky conversation by not doing it. Whereas I think had we done that, would have actually torched what could have ended up being a great network. And I more than happily put opportunities their way. They more than happily refer my name in years going forward, despite never having worked together in the first place.
Thank you, Rizwan. I think Yogesh has a question.
Oh, thank you. Are you okay if I vocalize it? Can you hear me?
Yes.
Oh, good. Okay, sorry, I'm in a noisy area. So thanks. Everything you said is definitely echoes with me, and I can do it all. But and I've built up networks in other business fields. I'm a GP, but I do property business and all kinds of other things. I totally agree with everything you said. But I just want to do the same in health tech. But honestly, I've Googled GP chat, ask friends, ask companies. I cannot find these conferences and networks that you say there are every day one of. I'm prepared to go to America, Australia, or Europe to find them, but I have Googled and two or three come up. But is there a resource, a network, a website, or can you just name me two conferences that are quite good to start off with? I just want the practical bit. Does that make sense? Yeah.
So I think I'd politely say that you're not looking in the right places then. There are, for GPs, I mean, there's a conference in Birmingham next month, which is for GPs with tech. There's one in London the month after. There are loads, and it's just a question of going out there to find the forum which works for you. I think to find the ones which resonate with your environment, it would be useful to. There are AI WhatsApp groups, there are GP WhatsApp groups. I don't know whose it is, but there's someone who's got a lot of noise in the background, which is a bit difficult to hear. I can't give you a list of conferences because there are loads of them. I can't give you the ones which work for you because I don't know the ones you've tried or not tried. What I will say is it's just a question of being available and having the conversation. Google, I've had loads of conversations with Google. I've got nowhere with them. Okay, sometimes it's more about starting with someone who's doing something which interests you and starting off the conversation, not with a view to you wanting a transactional commercial relationship with them, but actually just because you're interested in what they're doing and learning more about it and finding out how it might be applicable to you, and then saying, well, do you know what? You might think that, but in my day-to-day as a really busy GP, I don't think that would work quite how you thought it would. Whereas if you did X, Y, and Z, that might help. And all of a sudden, you've then offered an insight into something they might want to work with you going forward. All too often, I think people are wanting a really neat package of here is the commercial rate, here is the company, here is a job, how do I do it? And it's not, it's an incremental thing. This, as I said, I spent years talking about my interest, not because I wanted to carve a career. There wasn't a career then as such. It organically grew out of just having informed conversations with people and people then understanding that we like this guy's approach to going forward. I'm sorry, I appreciate I'm not giving you the answer you want to hear. So you've just put a question in the chat, which I find a bit frustrating, if I'm honest, insofar as I I post minimum once a week about mentoring opportunities that there are in health tech spaces. I put on annual conferences. I put on workshops. I've got websites which have got all these things. When I do them, people don't come. I'm not trying to be salty, but the principle is people who say there are none of these opportunities don't then seem to find their way to when they are, or when they are available, they don't work for them. And I'm not, to be clear, I'm not trying to ad hominem you. I'm talking generically here. One has to be flexible, which is if you want some of this stuff, you have to go out and be available at the time these things take place. Some of it is also be respectful to other people's time and space and flex around their availabilities and what their time. Stop asking the same question that everybody else has asked if there's a recording to answer that question ad hominem. once you've gone through those basics, well, then of course there may be something which is relevant or different which hasn't been covered, and then it can be fun to understand what it is you want to answer. I think there's a little bit of not putting the effort in and availing themselves of opportunities that are out there. And some of it, I said, we talked about conferences, mentorship, coaching, all these kind of things. They are available. Sometimes you've got to decide if you're willing to pay for them as well, actually, because again, how did I even start my mentorship program? It was because I went to a conference, had a platform, and someone by the end of it said, I really, really want to do what you want to do. There's no one to guide me. I went, all right, well, I've been to loads of these and I keep talking about this. Do you know what? There was a common theme in that conference of, yeah, we could do it with someone who's been there and done it, to be a wayfarer. And so the challenge was fair enough. I'll go away, I'll mock something up, but then it's up to you to then avail yourself of the opportunities that are made available. And you find you do this, but then people don't. And it's that middle ground of finding the right space that works for you without me having to redo what I'm doing all the time.
Yeah, and I would just also like to add that I did put in some opportunities that you can have a look at to get started with some of the health tech conferences across the UK. So definitely have a look at that, because I understand sometimes it's difficult to find them as well. So thank you so much, Dr. Rizwan, for your answers. We really appreciate speaking from experience as well. We wanted to also share, there's a really quick QR code for everyone who's attended. Thank you so much for being with us tonight. I know it's a Wednesday evening and there's so many things you could be doing. And thank you, Dr. Rizwan, as well, for giving up your time to speak to us as well. This is just literally a 1-minute survey that's going to help us out a lot. So if you are able to fill it out, we'd really appreciate if you could scan the QR code.
Perfect. I'll pop it in the chat as well. Thank you so much, everyone, for attending. And thank you, Dr. Rizwan, for giving a really insightful talk. I think it's always useful to hear how other people have sort of navigated into the space. Just for anyone sort of wondering where to sort of find more of these opportunities and this kind of thing, I mentioned this at the start of the talk, but if you weren't here, our website will be in Connect. If you sign up for our email community, we send out monthly sort of health tech opportunities that you can get involved with, and these range from medical students all the way up to consultant level, and also in other job roles, so nurses and pharmacists and etc. So do sign up for those and get involved. And as Rizwan mentioned, if you are looking for some mentoring, then do check out his website. I would just resend the links just in case anyone can't see them. But yeah, thank you so much for attending, guys. And yeah, was anything from you, Yosha?
Yeah, just of course, if your questions also didn't get answered in the time frame that we have, we'll pop in our email as well. When you sign up to the emailing list, you can contact us directly from there and we will answer. So please send over any more questions. We'll also ask Dr. Rizwan if he has any more answers for you guys after, if you send your questions along. But yeah, thank you so much for joining us this evening, and we'll be definitely hosting more events in the future on different topics, so please stay up to date with our LinkedIn queue. That is all, and thanks to KCL Cards as well for organising, and I hope all of you have a good rest of your evening.
Again, thank you all for giving up your evening to attend. Thank you, Yosha and Tristan, again for the invitation. Hopefully we gave some grounding. Good luck. Look forward to seeing you around, and we'll take things going forward.
Thank you.
Thank you very much. See you guys.